Now, in this lecture, let's talk about the birth experience. Okay. Now, it's your birthday. Well, not your birthday, but the baby's birthday that we're talking about. So, after about approximately 9.5 months, so 38 weeks after conception, the baby is ready to come out. And now the baby is usually very good at achieving the head down position. Now, in the unlikely event that the baby's head is at the wrong position, then what they usually do is they would do like either like trying to have the baby um, fix its own position, or sometimes there may be some like major maneuver that the midwives have to do in order to help to turn the baby's head upside down. And it's also really important to kind of make sure that the baby's head is not wrapped around with the umbilical cord. So that's something that can be really fatal for the baby. Now, the uterine wall contractions, and the baby passing through the birth canal is very painful for the mother because the tissue is being stretched to the maximum, and also the pelvis needs to really open up a lot. Now, in the event that when the pain is too much to bear for the mother, then they may elect for cesarean sections, C-sections, okay, as opposed to a natural birth that is vaginal. Now, the birth experience itself is not painful for the baby, though. Now, in the event of in the vaginal birth, you'll see that this can like temporarily reduce size of the baby's head, and because it needs to really squeeze through a very tight canal, right? And then now at this time, this is actually going to stimulate a hormone that is going to help to withstand mild oxygen deprivation that is being when in the birthing process, okay? And now the squeezing part, squeezing through the birth canal, is actually good for the baby in the sense that it forces a lot of amniotic, I can really have a hard time pronouncing that, forces the amniotic fluid outside of the lung. Okay, so this is gonna get the baby ready for its first breath. Well, I mean his or her first breath. Okay. Now, let's talk about the diversity of childbirth practices. Okay. Now, on the left, what you have is this is the medical model of childbirth in United States. Most people opt to have the birth of their child inside of the hospital, okay, where there are a lot of nurses, a lot of doctors kind of attending to and welcoming the birth of the baby. And now on the right, this is the childbirth in South Sudan. And you can see that how this is different from the normal in United States. And the baby is usually born at home with help of grandparents and and a qualified birth attendant, all right, so midwife basically. So, and I have to say that this is the way that for centuries, well, actually for millenniums, this is how the birth has been in the past. Okay, when hospital became like the norm, and so you see that. Definitely, this is, I mean, there isn't anyone that is good or bad, or good or bad per se, and it's just something that's kind of like cultural differences. Okay, now one of the things I do want to kind of like address is that the culture pursue like they have similarity in the goals, and then so this the first one is safeguarding the survival and health of both the mother and the baby. Okay, and the second goal is to ensure that there is social integration of the new person. So, okay, the first one is obvious, survival of the health of the both the mother and the baby. And the second one, social integration with the person. Well, what does that mean? Well, that means that you basically kind of welcome a new member of the family into the house, and whereas in many ways in some other cultures to a new community. Okay, because as we know that a lot of the cultures, they when a baby is being added to the family, it's not only added to the family, but it's only added to like the village, or it's being added to the whole community. And because a lot of the upbringing for many cultures is kind of like the whole village is like a big happy family and things like that. But these two goals are mainly the same when it comes to the childbirth practice. Survival and health of both the mother and the baby, as well as the social integration of the new person, the new baby. Okay. Now let's just do a very quick comparison between two cultures, Bali, that's in Indonesia, and USA. Okay. Now in Bali, what happened during the birth experience is that the families, they really gathered together, and a lot of the females in the family, they are going to help out with the birth process. So then you'll see that the whole family kind of joins together and really enjoy and just have this celebration of this joyous occasion of arrival of a new person. Now, as a result, the Balinese women, they really know what exactly to expect when it's their first birth, because they have helped out so many of their relatives doing so. Now, in USA, this is completely the different story. The woman in labor, is going to basically withdraw completely from their everyday life, and they're gonna enter the hospital mostly, and then the birth is supervised by medical staff like midwife or nurses or doctors, and all of these are strangers, and then these women in general, they have no idea what they'll be facing for their first child, be unlike the Balinese women, because they have never helped out with the actual birthing process, and even they have kind of went along with, let's say, their sisters or their cousins to the hospital, but they're not allowed to go into the birthing room. Only usually the father is allowed to do that, and sometimes the father is not even allowed to do so, and that is going to and that doesn't help the woman to kind of have an expectation what is going on when it's time for their first birth, unlike the Balinese women. Okay, so this just trying to. I'm not saying which culture is good or which culture is bad. Just saying that this is how different the diversity of birth child of the childbirth practice are around the world, just by these two different examples. Now, what are some of the roles for the father during the birth? Okay. Now, so these are the possible roles that the father can play while during the birth. Okay. Now, of course, you can be a coach. Now, this is the most hands-on role, and the father is going to help the mother relax and push. You can cheer her on and be her advocate with the hospital staff. In some cases, the father may get to lift the baby out and put it on on the tummy, and now, and also, this is something that a lot of the people do, and I think this is the most hands-on role, and this is actually good for kind of guide through the mother through like breathing and relaxation exercises. So now, no matter how involved that the father decides to be, the childbirth classes can really help to kind of they can really help the father know what to expect and ease their mind in about the childbirth. Now the second one is being a teammate. Now if you want to be in the game but you don't want to like quarterback, now you might like this role. So basically you provide encouragement and help out when the pregnant mom asks, and then but then you'd be kind of content to let her what the nurses tell you and how much they want to do. Okay, and another one is possible is cheer from the sidelines. Okay, it's kind of like the cheerleader. It doesn't really tell the wife with the pregnant mother what to do, and a lot of couple choose this option. And that means that the father is there to hold the pregnant lady's hand and then rub her back, and you can kind of take pictures and take videos of the baby's birth and this kind of thing. And but then doesn't really kind of take a very active role in basically telling the mother what to do. Okay, now the last one is just for me, I think it's like the laziest one. This is to leave it to the professionals and basically wait outside, and it just doesn't want to play that much part of it, and just rather going kind of walking back and forth and say, is it done? Is it over? Is my son out yet? And this is something if I'm the father, I would not want to play in this role because that's not very being proactive. But I have to say that in some cases, a woman doesn't want her baby's father there, and of course, sometimes the woman is going to scream and say, "Look out what you made inside me," and they can take the anger because it's very painful to have the baby, right? They can take the anger out on the dad. So in some cases the woman doesn't want the baby's father in there, and if this is the woman's choice, and just gonna have to respect her on that. Now, but the thing is that if the father has not been involved in the pregnancy, and or if even estranged with her, I think this is a good chance that she won't let him in there. And so whatever the reason is, if your presence if the father's presence in the room kind of makes it stressful for the mother, it's actually it's like a good idea to leave leave the actual birthing to the professionals and let them do their job, because it's actually better for the father to be elsewhere rather than next to the mother, because this can add more stress to the mother, and this can be pretty harmful for the baby. Now let's talk about the new baby. Okay, now one of the things that we know by common sense is that the baby is going to start acting with the environment right away, right? It's going to start breathing, and it's going to start as a form, it's going to start to cry as a form of communication. And then now even though a lot of the time their eyes are not open, they actually do start to learn about the new environment right away. Okay, now the next concept I want to introduce is the state of arousal. Okay, now the state is basically the level of arousal and engagement with the environment. Now it can go from deep sleep to intense activity. Intense activity for the baby usually means like happy and smiling, or could be really crying like a lot. Okay, it's telling you, I want my diapers changed, I want food, I want this, I want that. Okay, so the state of arousal can really influence the way that you interact with the environment, and also how the others interact with you. I mean, because obviously, if the baby is soundly asleep, the mother and the father is going to be like, oh, thank God, he or she is sleeping. I can get some sleep too, right? So it's not gonna really, it's not going to bother the baby. because the worst thing is a baby that got awakened in mid-sleep and starts crying, and nobody wants that. Okay. Now, when you look at the chart on the right, this is basically how much a newborn spend their time in an average of 24 hours. Okay, so about 8 hours, it's spending its time in active sleep. Okay, and in about another 8 hours, they are spending their time quiet sleep. So this means what? Well, this means that about 16 hours a day, the baby is sleeping, and then on top of that, there's 1 hour spent like somewhere like in between. Okay, drowsing. Okay, so you're really looking at about 17 hours when the baby is asleep. And and this is truly so because the baby um we'll talk about why they sleep so much later, but you'll see that later on you'll see that this amount of sleep really decrease as the baby grows up, and there is a function of age in terms of how much sleep a person gets, and you'll see that when a person gets their 50s, 60s, and 70s, the amount of sleep that they're getting is very, very little. And this is why your grandmother and grandfather sleep so little. Okay, and I start to find myself the same way. I definitely sleep a lot less compared to when I was in my early 20s. Um, anyway, so it's not, so a baby definitely sleeps a lot compared to um, his or her father and mother. That's for sure. Okay. Now let's briefly talk about sleep. Now this is just like an oversimplified crash course on what sleep is because I'm putting it in the context of a new baby. But in reality, there are many stages of sleeping, okay? And I do want to say that, for instance, the stuff that is not being mentioned here is something like the sleep spindles or like the K-wave complex. These are the things that are not being mentioned here. In general, what we can kind of separate out is there are two main forms of sleep. There is the rapid eye movement, and this is the deepest sleep stage, and this is associated with dreaming in adults. And so this is characterized by quick, jerky eye movements. Okay, and there is also the non-REM sleep, and this is the quiet sleep state that's characterized by the absence of eye movements. Now, if we were to look at the brainwave activities, and what you can kind of appreciate is that there is the awake, there is the REM sleep, and there's the non-REM sleep. Okay, you can kind of appreciate that they really look very different. Okay, and so the x-axis, like over here, that is time. Okay, and then the y-axis, that what you're seeing, this is basically the oscillation differences in the brain waves. So you can see that in the awake state, there is a lot of oscillations that is going on that's being recorded by EEG. Okay, but in REM sleep, you can see that this is relatively quiet compared to the awake state. And in the non-REM sleep, you can see that although this is quiet, but then there is a lot of variability when it comes to the actual brain waves. Okay, and then the non-REM sleep, I must say, has several other subcomponents. Like for instance, the sleep spindles, the K complex waves. These are the things that that we're not talking about in in this lecture. But then in general, I just do want to bring it up that they do exist, and then this is just an oversimplified version of what sleep is. Now let's take a look at the amount of the sleep that a person normally gets across lifespan. Okay, now in the x-axis, what we have is the age of the person. On the left, we have a newborn, right? And on the right, we have adults that are kind of like at the other end of the lifespan spectrum, that about 90 years of age, right? And in the y-axis, what we have is the amount of the time per day spent in sleep. Now, there are two types of sleep, okay? There is the rapid eye movement sleep and there is the non-rapid eye movement sleep. So I'm going to um, say rapid eye movement as REM, and some people will call it REM sleep. Okay, and then the non-REM sleep, and you can see that as we said before, a newborn all the way on the left is going to be spending about 16 hours in a day sleeping. Okay, now let's take a look at your grandmother's age somewhere in the 50s and the 60s. Okay, over here, you can see that the amount of the sleep that they get per day is about approximately 6 hours. Okay, I am in this range. Okay, so I sleep, and this is right, I do sleep around 7 hours a day. Okay, now, one of the things I do want to mention is that, so you can see that the amount of the sleep in general is decreasing. That's the first thing. And the second thing is that the amount of the REM sleep is exponentially decreased after the after the human hits like puberty. Okay, so you can see that at new age, well, not new age, in a newborn, they sleep a lot in the REM sleep. So about almost like I would say 8 hours in there, right? And then when they get to like the children when it's like 3 to 5 years old, and then you're looking at maybe a little bit less than 2 hours. Sorry, 4 hours, a little bit less than 4 hours, right? And then when you get to this stage, then in adolescence, that's somewhere between 14 and 18 hours. And by looking at this is about 2 hours. Okay, so you can see that the amount of the REM sleep, which really is the deepest form of sleep, is exponentially decreased as we develop. Okay, and on the other hand, the non-REM sleep, it really depends. Okay, you can see that there's a general trend that it's decreasing, but then as a baby, the proportion of the non-REM sleep is about 50%. Okay, and then around when they get to childhood, and then that actually goes up a little bit more. They need a little bit non-REM sleep proportionally, and then, and just like the REM sleep, you can see that the non-REM sleep is decreased as the humans grow up as well. Okay. Now let's take a look at why rapid eye movement sleep is so important for the infant. Now, one of the things that we know is the common sense is that the new baby has just been introduced to the new physical environment, right? So the REM sleep is really important to kind of help the new infant to really assimilate them for the new physical environment. And the reason being that because everything is very new to them, and so all the stimulation, all the environment are very new. And then so if they are not sleeping all the time, and this is too much for the nervous system to handle. And then on top of that, since REM sleep is much more recovery in nature, because we said before this is the deep form of sleep, this actually helps them to really recover from all of these new novel sensations that they were not familiar with when they were in the womb. For instance, the visual system in the uterus, they don't need so much light because there's no light, right? So even if they were to open their eyes, they don't need to use their eyes that much. Okay, so these are the two reasons. Now, the third reason is that the myoclonic twitching. So this is like a sudden jerky movement that you make while you are like sleeping, and sometimes you actually get awakened by it. And so this kind of twitching is not pathological. This is actually helpful. This is something good for building the sensory motor map in the infant. Also, this in adult is a little bit different. It kind of make you kind of assemble and maintain your sensory motor map. So this is a slightly different in adults. Now, so the fourth reason is that the REM sleep is really important is that it helps with learning. Okay, so and especially this one aspect called the memory consolidation. So they have done studies where um, when they are performing one set of action, okay, and then they were to look at like the set of neurons that's going on in the brain, and the set of the neuron that were active during awake learning gets reactivated during this REM deep sleep. So, so they kind of suggest that during this REM sleep, there is kind of mental rehearsal on that is happening on an unconscious level, and this helps a person, in this case, a baby, kind of learn the aspect, and this is what caused the memory consolidation. It basically consolidates what you have learned previously into your long-term memory. This is something we'll talk about also later when we talk about cognitive development. Now, let's talk about this topic, which is babies crying and why do they cry so much? Okay. Now, let me ask you guys a question. How do you feel about babies crying? Now, you probably think that, well, it really depends on is it my baby or is it someone else's baby? Now, chances are you are too young to have your uh, own child, so which means that you haven't had your own baby. But if you had like a younger brother and younger sister when you were younger, and you probably heard a lot of his or her crying when he or she was born, right? And a lot of people's initial reaction is that please make that crying baby stop, okay? Now, this is, of course, no exception when it comes to the mother and father, but there is a layer that is adding to it is that the reason I want to make it stop is not because it's annoying, which it is, but it's the reason is that they love their own child, and then they really want to make sure that he or she is not harmed, is not hungry or in pain. Okay, so as you can see that the baby's cry, it kind of signals the need for attention. Okay, and this promotes survival of the species. Now, initially, you might think that mothers they are more responsive to like crying babies, and because it's the one that is carrying the resources, like the breast milk, right? But there is a huge confounding variable. Confounding variable means that this is something that needs to be adjusted or something that can be an alternative explanation for something. And that is mothers tend to spend more time with the babies. Okay, now so what happens is that when they adjust it for the amount of time that's spent with the baby, the father and the mothers, they are about the same when it comes to responsiveness to crying babies, which means that regardless of the gender of the caregiver for the baby, the amount of the responsive to crying is about the same. Now, let's talk about the baby crying behavior and how the parents deal with them. Now, the crying behavior actually is the most around 6 to 8 weeks after birth for some reason. Now, it kind of slowly, progressively decreases around 3 to 4 months of age. And because at this age, they have more control of the environment and they also have interacted with more. And also, this is when they have more of the motor skill and also their cognitive skills that are developed. Okay. Now, one of the things I want to bring up is that the parents they can really have a lot of anxiety due to babies crying, and of course, I have to say that baby crying is very annoying. Okay, and then especially the one that just doesn't matter kind of like what you do, it just won't stop crying because somehow some of the needs is not being met. Some of the needs is not being met. So, which means that the parents, when the child is just nonstop crying, for a reason that the parents cannot figure out why, then they can have all of these common feelings. They can have guilt, they have anxiety, and some would even have something called the shaking baby syndrome. Okay, this is a real thing. Okay, so in which that they actually hold the baby and then shake them and say, "What is wrong with you?" And stop crying, and stuff like that. And of course, this is not good for the baby because they are very fragile. And when you shake them like this, they can produce a lot of physical harm to the baby, and in some countries, it's even illegal to do that. And then what happens is that then this can really cause a lot of physical trauma to the baby, and then the parents are need to bring them to the emergency room. The parent might end up in jail, and then the baby gets a lot of how do I say this? The baby gets really injured, and then it's gonna cry even more. So why do it? Okay, so whatever you do later on when you become a parent, please do not shake your baby. I would consult with, um, let's say, neonatologist, or consult with child psychologist, or infant psychologist, or even just talk to people who are really experienced, such as your mom and your dad. And this can be all very helpful in dealing with a crying baby. But just whatever you do, just please don't shake them, okay? Now, what are some of the methods that you can try to soothe a crying baby? Okay, now your book talks about holding, rocking back and forth, singing to the baby, and the pacifier, of course. And it also talked about something called swaddling. Now, this is pretty much you wrap a baby in a tightly in clothes. So this is basically what a swaddling a baby looks like. And and there are some controversies with this, and that's because if you kind of wrap your baby too tight, this can kind of restrict their movement too much, and then that can be actually harm a baby. But then, so there are a few things that are kind of that's a little bit controversial, but textbook definitely your textbook definitely recommends this. Another one is gentle touching. So gentle touching is something that is good. You can see that the infants fuss and cry less, and they smile more if the adults pats or rubs or stroke them. And then, so this is something that is good for the baby, and that's because you're giving them some sort of sensory stimulation, and then this is something that is very soothing for not just the baby but for anyone. Okay, just imagine that if you're really stressed out and then you're not in a good mood, you go for a massage, and then all of a sudden you feel better. And so I guess this is just kind of human nature. It doesn't really matter how young or how old you are. You just really enjoy a good gentle touch from somebody. Well, ideally someone you love. Okay, right? Of course. Now, so far we have been focusing on the baby. Now let's talk about the mother and the father as well. Now, so let's talk about something that we see the most frequently, and that is postpartum depression, the PPD. Now, this affects about 15% of the women after giving birth. But I have to say that this can affect both mother and the father. Okay, now the exact cause is not known. The factors that kind of contribute to this, it could be a lot of things like hormonal imbalance, sleep deprivation, obviously, days leading up, sometimes weeks leading up the actual birth. It's a very stressful time for the mother as well as for the father. And there are also a lot of changes at work and things like that. And it could be also lack of social support, especially in like the Western society, such as America and some European countries, where um, giving birth to a baby is no longer like a huge family event, but rather is like a small family event, right? So this can really lead to like a lack of social support, and also there could be like a fear of a major life change because especially if it's your first baby, there's a lot of added responsibility to your life. You are no longer just responsible for yourself. Now you are responsible for this a whole new person, especially with the baby that you do not that just they can't even take care of themselves. Now you have to take care of them and you have to take care of yourself. So that's a lot of responsibility, and also that could be also another factor that really contributes to this postpartum depression. Now, what are some of the treatments that has been used for postpartum depression? And this is a lot of it use psychotherapy, trying to find the root of the problem and then trying to kind of structure your thoughts and beliefs around the postpartum depression. Okay, and another I don't want to say controversial, but then another tentative treatment is also using the antidepressants. For instance, the SSRI, the selective serotonin reuptake inhibitors, that can also treat the depression. Does it get rid of the postpartum depression? Not entirely, but I have to say that there is something that is different between just something called the baby blues versus the postpartum depression. Okay, so the baby blues are something that a lot of mother, definitely a lot more than 15% of the pregnant women, that a lot of the mother experiences after they give birth, and that is because they have just used up a lot of their physical energy to give birth to this child, right? And then what happens that there is a lot of hormones as well as neurotransmitters that which is literally peaked up to like the highest level, higher than a lot of peak to a lot higher than normal levels. And after the birth of the baby, all of these hormones, neurotransmitters, all of that gets dropped to like a new low level. And this feeling is associated with lethargy and kind of an energy depleted state. And then so for a while, usually give about 20 days to 30 days after the the woman has given birth, she is in a extreme state of I don't want to use the word malnutrition because it's not really true. It's just kind of a lack of energy. So this is really important. I know that a lot of many cultures has like this 1 month rehab or recovery program for the pregnant woman. So for instance, in the Chinese culture, we have something called sitting 1 month out after you give the baby, right? 坐月子. Okay, so I think if you speak Chinese, you know what I'm talking about. So this is where the the mother of the pregnant mother, or sometimes the mother of the father, is really kind of treating really nicely to the pregnant woman so she can kind of come out of the baby blues. So but I have to say that this is for people who really have the luxury of social support. Now imagine that if you were already in that baby blue state, and but you don't have that social support from your husband or from your mother or from your husband's mother. uh, it's really easy to go from that baby blue state to that postpartum depression state. So this is why it's really important just to kind of have that really strong social support and to really kind of pamper yourself after you give birth. Okay. Now, of course, the postpartum depression has a very negative outcome on the baby because when the mother is not feeling well, when the mother is depressed herself, she cannot adequately take care of the baby. And a lot of the times, it depends on the country, but most time the paternal vacation in which that the father is taking off from work due to arrival of the baby is not that long compared to the mother. Now imagine if now the mother is now with the newborn baby, but she is so depressed that she cannot take care of the baby and so cannot adequately feed the baby, cannot attend to the baby's needs. So of course, this is going to have a very negative outcome on the baby, in which we're going to talk about it later. For instance, malnutrition is going to cause um, um, bad development with delayed development for this newborn child, right? So this is something like that. The postpartum depression. This is something that can really have a negative outcome on the postnatal development of the baby. Okay, let's discuss some of the negative outcomes at birth. So one of the ones that your book really mentions, that is the infant mortality. Now, infant mortality is defined as death during the first year after birth. It should be relatively rare in like the society in like the industrialized world. Um, so here I listed a few countries that has the lowest mortality rate. So for instance, Monaco has 1.82 out of 1,000 births, so that's really low. Iceland and Japan are not too far from that. The highest ones are like Afghanistan, Mali, and Somalia. So these are kind of around 11.5% to like 9.8%. So when you kind of think about it, it's a pretty high number. That means approximately one baby in 10, 1 out of 10 baby dies after within the first year. So that's something that is not good. Now, United States is it's somewhere in 5%. Okay, so now why does the country that has the greatest GDP so many die in US? Well, it has to do with poverty. And one of the things that you may know is that US has a lot of poverty disparities when it comes to income. So the richest are very rich, but the poorest are very poor. And so the very poor ones, they don't adequately get enough medical care or enough education during pregnancy, and all of these can really lead to a higher infant mortality rate. Okay, now next, let's talk about low birth weight. Now, anything that when the baby is born at below 2.5 kilograms, this baby is considered as low at birth weight. Okay, and now this could be due to preterm babies, which means that they came out of the mother before 38 weeks. Okay, now what are the causes for low birth weight? Well, one of the or two of the ones that you see the most often are the teratogens. Okay, so if there are some sort of teratogens, such as if the mother was smoking or alcohol, or there was like environmental pollution, such as like heavy metals, this can really make the mother well, not being a good vessel for the baby, and which means that the baby is not going to get enough nutrient. And on top of that, it needs to deal with all this teratogenic stuff that it doesn't have to deal with if the mother was um, good, so to speak. Another thing could be mother malnutrition. Now, I want to point out the mother malnutrition is directly linked to poverty, right? Because if you don't have money, you cannot eat. That makes sense, right? So that would actually mean that the one of the major one of the major risk factors for your babies to be born on low birth weight is actually your socioeconomic status. Okay, because if you are like starving to death and you don't even have enough to eat, how can your baby get the actual nutrients? It's not possible, right? Okay, so those are the two main causes: teratogens and malnutrition for the mother. Okay, now the low birth weight can be very stressful for the parents. And now, of course, if you are being a parent and then you just welcome a new member of the family to your home, and it's not easy at all. Now, if you are learning that your newborn baby, the one that you prepared 9 months for, is very sick, this is very, very stressful for the parents, okay? And a lot of the times, this is very dramatic for not just the mother, but also for the father, and even sometimes, and I think in this is going to be especially true in Chinese culture, or in Asian cultures, that the grandparents is going to be the saddest, because as we know that the Asian grandparents really love to take care of the grandsons and the grandchildrens, right? So there's going to be a lot of fear and doubt, and also, of course, the feeling of guilt. That did I do something wrong when I was pregnant, or inadequacy? How can I possibly take care of the sick child? And also, of course, fear. Will my baby survive? You don't want to lose something that you have planned and love so much. So, so this is something that could be very, very stressful for everybody. Okay. Now, what are some of the long-term outcomes for a low weight at birth? Okay. So one of the things that we know is that children who were low birth weight infants, they really have a higher incidence of developmental problems. So, for instance, if they have like low birth weight, they have some sort of sensory impairment. They might have a poor academic achievement. They might also have a higher likelihood of some psychiatric issues such as inattention, anxiety. They might have social difficulty, something like ADHD, attentional hyperactive disorder, or autism. All of these things are somewhat correlated with low birth weight. Okay, so this is something, if you can later on when you're pregnant, please be nice to yourself, because while you are being nice to yourself, or if you're a guy, when you're being nice to your baby, you are really avoiding all of these stressors later on in life. And then I assure you that your child is going to repay you. Now, imagine if doing that 9 months while your wife with you when you were pregnant, you're not very nice to yourself. You were drinking or smoking, or if you were doing things where you're overly emotional, you're depressed all the time, and you're getting too stressed out, maybe at work. All of these are not good for you. And then and later on, you're gonna have to give up your work to take care of your baby once it's born. So it's not worth it. So please, later on when you become pregnant, or when your wife become pregnant, just be nice to her, or be nice to yourself, because this is not just being nice to yourself, but this is also being nice to your baby, and which is being nice to your future self. Okay. um, Now, what are some of the intervention programs to really help with low birth weight babies? Mm, Well, there are, and for instance, hospital, they really have programs that really, for instance, there's the neonatology department, or there are the ICU for neonates. They call it NICU. Okay, and then what happened is that these NICU units, they have specially trained nurses and doctors to really take care of these baby that were born either preborn or born at low birth weight. Okay, now one of the things that they utilize is actually the touching experience. So the infant massage is something that is very beneficial for the baby, especially a preterm baby, and they can really benefit from all that extra touching. And so this is something that when you kind of you can play with their arm, not play, but you can like flex their arms and legs. So the babies that receive this therapy are more active and alert, and they gain weight faster than the one that were not massaged. Okay, so which means that they go home earlier, and they also have a much higher likelihood of regaining or like develop like a normal kid would develop. Okay, so this is something that's very useful for the preterm or the low birth weight babies. Okay, sorry, I'm having problems speaking low birth weight. Okay. Okay, so far we have talked all about this negative stuff, right? On the baby or on the mother or on the father, how stressful it is when things go wrong. I do want to end this lecture on a more optimistic note, and that is the concept of resilience. So, what is developmental resilience? Your textbook defines it as successful development despite all the multiple overwhelming hazards. So, which means that the odds were stacked against this baby, but despite all that possible negative outcomes, they thrived and they overcame, and then they developed as normal. Okay. Now, what are some of the factors that can really contribute to such developmental resilience? So the first one is the personality characteristics, and this could be the intelligence, the responsiveness to others, and this could be the sense of being capable of achieving their goals. And now I know you're probably thinking that, well, but they're just a baby. How can they do that? Of course, like the intelligence and the responsive to others, this is going to come slightly down the line. But even when the baby, when they start to be in some sort of, let's say, a month, 1 month, so you can start to tell their personality already. And there are just ones that are really trying to interact with the environment. Those are the ones that are very tenacious and they are fighter in spirit. And versus the ones that are kind of more timid and the ones that are kind of like mousy and they don't really want to like approach stuff. They don't want to try stuff that's kind of new. And of course, this is kind of all embedded in the genetics of their personality. Okay, so the personality characteristics of the infant can really make a difference. Okay, now the second one is the responsive care from someone. So most likely the family members. So it could be the parents, it could be the grandmother, it could be even friends. Okay, so and it really is about the societal or the community resources that this infant has access to, because the grandmother or the grandfather may know a friend or a doctor who can really help out with all of these negative outcomes for the baby or for the mother, you know. So this can really help give all the resources to the family that is in need of these help. Okay, so these are the things I kind of just want to bring it out there. And so now I want to ask something, and this is something that is true in life. And what is resilience? Okay, so resilience is this that you it's I don't want to say that either you have it or you don't, because this is definitely something that can be developed and this is something that can be done through social modeling. you watch how other people get brave and then they face their um, fears and then they achieve their goal despite all the naysaying. And this is going to be true in your life, whether you are now in DKU or later on after you graduate from DKU and you go into the real world and have a job. And you are going to have hardships that are going to be stacked against you. But don't give up. Instead of giving up, you should look for ways to solve your problem. And if you cannot solve your problem, you kind of let go and don't let it bother you. Okay. And but of course, you should try to solve the problem as much as you can. Okay. And then so that is really important. And you should achieve your goal and you should achieve your dream because that is what you meant to do when you were born into this wonderful world. Okay, so don't let whatever reason, it might be environment, it might be even genetic, it may be from your friends, your father. Just don't ever let other people be a factor that negatively affect you. You should achieve your dreams and goals. I mean, of course, without hurting others, you know. But of course, you should try to become a fighter in life. But the way I would like to also think that if you are really doing something that you love, then you should just go for the things that makes you happy and without really trying or have to fight. And in psychology, we have a term that is called a state of flow. And if you can be constantly in that state of joyous, floating kind of experiences, this is something that is going to make you keep having these very high emotional states. And that is going to keep you bringing you to the next level of success. Kind of similar to when you got all that letters from college acceptance and you kind of feel like I can take on the world. So those are the feelings you want to keep going back, trying to milk it for all that you can. And so just kind of focus on all of these things that brings you happiness and even think about back in happy memories, and that is how that is how your life will get better and better, and that is the key how you can really reap the benefit of your happiness. And that is also the key to make your life and other people's life a better place. And in general, that is also how you make the world a better place, by bringing that happiness to other people. Okay. Okay, so for today and tomorrow's assignments, so for today's assignment, this is the first one in the thread discussion. I want you to write about maybe just 3 to 5 sentences about what do you think the role of the father should be. Now, I know that we have talked a lot about the role of the mother, and the mother can do this, that the mother should do this, the mother should not do this, that the mother should not do that. But what do you think the role of the father as well as the baby's grandparents? Now, this could be the mother's father, the mother's parents or the father's parents. What role should they play during the birth process? Okay, and of course the kind of care the mother and the babies, what should they receive? I mean, don't just say something generic like they should receive the best care. Well, I know that, but then what? Give me specific examples. What kind of care should be given to these mother and the babies? Okay, now for tomorrow's discussion topic. Uh, we are think about what kind of side that you want to take. Okay, so and the topic is this: what are your views on planned date birth? And you might become so you know that a lot of Eastern culture have this thing: if you were born under the stars, you are going to be lucky. You can be rich for the rest of your life. And of course, the Hindu astrology has this kind of thought process as well, right? And then, so what do you think about these cultural stuff in order to kind of have a better faith? Do you think this is necessary? What do you think is superstitious? And now there are no right or wrong answers, of course, because I have to say that astrology is not scientifically studied. And so this is something that I would like to bring up during our discussion tomorrow, because a lot of, especially in the Chinese culture, as well as some other Asian country cultures, is that because they are planning to say that this is a good time or a good day to give birth, and this actually overwhelms the hospital systems. And then of course, and a lot of the time will involve some sort of C-section rather than a induced vaginal birth. And this is a lot of a lot of taxing on the resources in the hospital system. Okay, so I'll just give you a clue on that. So what are your thoughts on this? So be ready for tomorrow's discussion. Okay, I'll see you guys tomorrow.